I'm Jen Monteleone, Interim Executive Director of the TLC Foundation for Body-Focused Repetitive Behaviors. Thank you for joining us for this important conversation and celebration of International Women's Day. If you'd like to hear this event in Spanish, please bring your attention to the bottom of the Zoom toolbar and find the interpretation icon. It's a little globe. You have the ability to toggle back and forth between English and Spanish. You also have the ability to lower the English speaker and mute original audio if you only want to hear the Spanish interpretation. Some quick housekeeping items before we get started. This is a 60-minute educational webinar offered in a safe and welcoming environment for everyone attending today. Attendees have two ways to participate in the webinar: through the Q&A feature and through the chat box. Questions for the panelists should be asked through the Q&A feature, and your questions will be answered at the end of the webinar. If anyone has any tech challenges during the webinar, please use the chat box to message one of our TLC staff members, and we will be happy to help you. And now I'm pleased to introduce 4 women who have made a tremendous difference in the lives of people experiencing body-focused repetitive behaviors as scientists, practitioners, and therapeutic providers. Ruth Golomb, licensed clinical professional counselor, is a senior clinician, supervisor, and co-director of the training program at Behavior Therapy Center of Greater Washington, where she has worked since the mid-1980s. Ruth is also a member of TLC's Scientific Advisory Board. Dr. Nancy Keuthen directs the Trichotillomania and Excoriation Disorder Clinic at Massachusetts General Hospital. She's an associate professor of psychiatry at Harvard Medical School. Dr. Keuthen is a long-term member of TLC's Scientific Advisory Board and has served as a principal investigator of the TLC's BPM Research Initiative. Sherrie Vavricheck is a board-certified clinical social worker with over 25 years of clinical experience. She has particular expertise in the treatment of OCD, trichotillomania, and other body-focused repetitive behaviors, as well as developmental delays and disabilities. Dr. Hannah Garza completed her residency in clinical psychology at the University of Texas Health Science Center of San Antonio. She has expertise in cognitive behavioral therapy for adolescents, anxiety, hair pulling and skin picking, OCD, tic disorders, and interpersonal effectiveness. Dr. Garza is the recipient of TLC's 2018 Early Career Award. Welcome, panelists. The 2022 theme of International Women's Day is Break the Bias, relating to equitable access to careers, equitable pay, and seats at the table. With that in mind, our conversation today will focus on our panelists' career journeys, their insights, and suggestions for others interested in participating in the field of research and therapeutic treatment in support of the BFRB community. So panelists, here's our first question. Why or how did you choose this career path? And whoever wants to start, feel free to lead us off.
I'll start. So my name is Nancy Keuthen, and I'm at Mass General Hospital, Harvard Medical School. So I'm in more of an academic medicine position, and very often in academic medicine, people look for a window of opportunity for their research and their clinical work. And when I started at Mass General, there was a group of people doing OCD research that I was very interested in. And so I joined the group, and lo and behold, we started getting a lot of referrals for patients that were hair pullers, and there was nobody that was doing research on trichotillomania and excoriation disorder. So I started, and I think the first thing we worked on the scale, the MGH hair pulling scale, which was published as long ago as 1995. And from there on in, I got hooked. We had many opportunities to publish research. I developed a number of international collaborators, and we got some funding, and I'm still here today. So that's my story.
Thanks, Nancy. Others on the panel? How did you choose this career path?
Well, I'll jump in. I was similar to Nancy. I was working with obsessive compulsive disorder in the late 1980s and doing some research with NIH where they were doing treatment for obsessive compulsive disorder and wanted some cognitive behavior therapy to be done as well. Some patients were coming into the study who thought they had obsessive compulsive disorder, but were pulling their hair. We found through, and they did not respond to the treatment, the CBT or the medication, the way that people with obsessive compulsive disorder did. So they were wondering what could be done. So I was working with Charles Mansueto and worked on really looking at these individuals and trying to find if there's another way to understand the hair pulling and perhaps another way to do the treatment. And one of the things I would just like to say is the community itself is such a warm and wonderful and welcoming community. It really drew me in and has kept me here for years.
Thank you, Ruth.
Yes, I'll follow up with that because I joined Charlie and Ruth under unusual circumstances, which I had known Charlie many years before. We had done some work together in the community, the general community, and I was working at a school, special ed school, part-time. And one day, after a long absence of seeing him, we literally ran into each other on the street. And he said, Sherrie, you have to come and work with me and Ruth. There's this exciting thing going on with this condition called trichotillomania, which of course I'd never heard of. And so, so he convinced me. And so I then had 2 part-time jobs. And then a few years ago, just came straight to now I'm just working with at BTC, but you know, he's kind of irresistible that way. You know, if he's enthusiastic about something, you know, he draws people in. And so I've been you know, happy to be there for several years. And Ruth was my first colleague, so good to be here.
Thanks, Sherrie. Hannah?
And yeah, I'll go. So I have had the benefit of the trailblazers of many of the women who are here on this panel, and who were able to start developing treatments and better understanding BFRBs. So I was, a little graduate student, trying to figure out what I wanted to do with my career, and not even really sure what kind of setting I wanted to be in or what that might look like. And as part of my training program, it's set up to do a year of training in different kinds of places or with different people. And I thought, hey, let me try out this private practice thing that, Suzanne Mouton Odom sounds like a nice lady. And she's on the scientific advisory board here with TLC. So a lot of her private practice works with folks with BFRBs and OCD and other conditions related to BFRBs. So I got a year of fantastic training with her and learned a lot about BFRBs, and that's kind of how I started getting into it. And I have family members with BFRBs, so it was something that at the time I didn't even really know was a condition, that they were conditions or things that had treatments. So kind of stumbling into it, working with Suzanne was just, I instantly connected to it for that reason. And echoing what Ruth said earlier, it's just always been a very warm, welcoming group to be a part of. And even as a young person on this panel, I've always felt very welcomed and encouraged to participate and share my input on things, which I think is pretty unique to this area compared to some other areas in the field that I have been a part of too.
Thank you so much. One of the questions that came in for us earlier was this: during your career, can you share an aha moment that deepened your interest in the work?
You know, I think there are little aha moments of many days. I don't think it's just one aha moment. You know, from the clinical perspective, there are these days where you just really know you made a difference in the life of somebody, that somebody says, no one has ever understood me like you have, or I've shared things with you I've never told another person. And, you know, the honor and the really the sacred trust with which a lot of the patients come to us is something that is just so meaningful for me as a clinician that it brings me back. You know, on the research end of it, there have been, and I don't know if you call this an aha moment, but just some victories that have just, you know, really kept me in the field. You know, like for example, when we were on the DSM-5 committee and we got excoriation disorder in the DSM-5, it's things like that that, you know, we can feed off of for a long amount of time that keeps us going back in and doing more research and, you know, just pulling the field forward. So those are things that have just been very meaningful to me.
Anyone else want to share any aha moments that keep you interested in the work or deepen your interest in the work?
Well, I've done a lot of training of professionals to treat BFRBs. And one aha moment was actually, I remember doing a professional training institute. May have actually been in Texas at the time, but I remember someone who was a trainee learning more about BFRBs said, you know, after I finish this, I'm going to be the only person in New Mexico who is trained to treat body-focused repetitive behaviors. And I thought it was wonderful that he was there, and I was dismayed that there was one person in an entire state that was trained to treat BFRBs, and it's really been, you know, a heartfelt mission to try to get as much training out there as possible. But I so appreciate it when people, you know, show up and are interested in learning about BFRBs, because I think it's more common than people think. It's very important, and I couldn't echo more what Nancy said, which is how important it is to be able to listen to somebody and have them feel listened to and understood, because we've had the experience. And also with that, I would also say another little aha moment is it's not just all about hair or skin, but we always want to remember quality of life and the way somebody feels about themselves and how important that is as well. So even if some of the hair pulling or skin picking may not diminish as quickly as we might like, if someone is feeling better about themselves, engaging in life more fully, that's also a win and important, and we never want to lose sight of that.
That's a really important point, Ruth. Thank you so much for sharing that. Hannah or Sherrie, aha moments?
Hannah, go ahead, then I'll go.
So for me, I think it was, I guess my first aha moment was when I attending my very first TLC conference, which it's, you know, kind of a unique conference, at least compared to some that I've attended, where, you know, people with BFRBs as well as family members or support people and professionals and researchers, clinicians are all there together at the same conference and able to attend many of the same kinds of presentations or workshops. And it was just, you know, it just added to the feeling of like a big family, and we're all kind of in this together, figuring it out and wanting to help each other figure it out. And just, you know, egos left at the door in, I think, a really powerful way, in a way that just really struck with me. It was like, these are my people. This is awesome.
Well, we're glad you're a part of our people too, Hannah. Sherrie?
Yeah, I had just a couple of thoughts. One aha moment was, when I first started working with people with BFRBs, because I had no idea like what they were like, what they looked like, what they acted like, this sort of thing. I had just no idea. And it was so impressive to me how impressive these clients were in so many ways, how creative and warm and interesting and available and really wanting to get help. And so that was really, stunning for me, to see these wonderful people. And then of course, Charlie and Ruth, and then this was early on, where the community started growing and getting larger and evolving in different ways. So I thought that was really exciting. I guess the other one is just like this is a small aha moment, but we know that BFRBs are multidimensional. And in the early years, we were, sort of trying to figure out what are the different dimensions and this sort of thing. And because I worked at a special ed school too, I remember one day I was leafing through one of the occupational therapist books, manuals, and they were talking about, the arousal level from a central nervous system standpoint of arousal and things that people do or could do to adjust the level of arousal if they were overly excited or upset, to calm themselves down, if they were feeling bored or sleepy, to be more alert. And it said things like, they could, drink water through a straw. They could, they could hug themselves. They could do this. They could do that. And then one of the boxes said, twirl their hair. I was like, holy smokes. So it's the twirling the hair, that sort of got me, really interested in the arousal level and sensory nature of the BFRBs. So that was interesting.
Thank you. All right, next question for us to chat about is, are there any lessons learned as females in this field that you're willing to share?
I think people have pointed this out, that this is a problem that is predominant for women, right? So I think it's particularly reinforcing and gratifying to me to have an impact to help other women that deal with this situation. But as a woman, I think we can bring special knowledge about hair and the importance of our appearances, that when we study this, I think it's helpful to have that information. So I think as a woman, I'm very proud that I've been able to, develop a line of research that has helped other women to flourish in their lives.
Some others on the panel? As a female, any lessons learned that you're willing to share?
I'm also a new mom, new-ish. I have a 1-year-old. So, I think it's a unique perspective to be a mom and kind of what it would be like, parenting your child. And that is such a special kind of bond to have. And I think it can be really complex when it comes to BFRBs, kind of commenting on what Nancy said too, just some of the social and cultural factors that impact women maybe a little bit differently. And so that I think is a perspective that as a woman you can bring in to the clinical work.
Thanks, Hannah. Sherrie or Ruth?
Yeah, I guess what I was thinking about was that I think that TLC has been very friendly to women practitioners. Now, I can't speak from the scientific or academic side of things, but the vast majority of people who would be at the early retreats, or conferences were women, and women were always encouraged to develop their talents, those of us who are clinicians. And, so it was such a young field too, that, Ruth and I, I think it was in 1990, wrote the first book for kids, maybe the only book for kids with Trek. Of course, now that's a little outdated because we're including, skin picking too. But I think that there's been a wonderful, opportunity for women to come into a young field that hasn't already been overwhelmed with all kinds, millions of articles and studies yet. So I would encourage women to take that opportunity.
Thanks, Sherrie. Ruth, anything else you'd like to contribute to that question?
Well, I think, women do have a unique experience with BFRBs and also in society. I mean, I think there are demands on women that are different, and I think it's really important for, as practitioners, to be able to help the women who experience BFRBs again feel understood with all of the many hats that they might be wearing at any given time. And I think we can help our brethren, if you will, to sensitize everybody to the many facets and multiple needs that women may have. And as Hannah said, I mean, actually at any stage, but young parents or parents of children who have BFRBs also feel just really misunderstood and sometimes blamed for their child's behavior, and it's really hard for them. So we need to be able to support this population as a whole, and really understand the unique experiences of women. And I think as women, we bring that to the table.
For sure. Thank you. So what keeps you coming back to this work every day? Why do you wake up and say, let's keep going?
I would say for me, honestly, as I said, the community, but the professional community has been absolutely wonderful, but the community that experiences BFRBs has been equally wonderful. It's a really interesting, smart, interested group of people who really want to learn more and understand why they're doing what they're doing. But the other thing is, early on, and I know Nancy and Sherrie can attest to this, but people were generous enough to sit down with us and explain what their experience was like, because none of us had ever heard it before, and people were truly suffering, but also willing to explain to us what their experience was like, so that we could become informed and then hopefully, better at helping them. And that was just a remarkable experience, honestly, and truly one that keeps me coming back.
I'll piggyback on that, because we were lucky that there was a whole cohort of people referred to us at the same time, basically. That's, I don't know if that's ever happened in the history of the world, that BFRBs clients are coming your way, and we were pioneers. So I thought that was, really, really exciting. And Ruth was talking about how, we were listening to them. And even still, because there's so many unique elements for each individual person who has a BFRB, that, each time you work with somebody, in a sense, you're creating a new approach to this unique situation. So in that sense, more than almost any other thing I can think of, there's a lot of collaboration in the room when you're working with somebody. It's, you're guiding them, but they're also teaching us So keeps me going, and they're great people to work with. So
I think that I draw my inspiration and my strength from many different groups. I think it's the community, the people that deal with this every day who are so incredibly brave. They're inspired, they're inspiring. I think collaborators like everybody you see here on the panel today, people that, as Hannah referred to, we all need to be humble. You know, we come into this wanting to make a huge difference, and I think we do a lot of the time. My research collaborators across the world, I've had the great fortune of working with people like John Grant and Dan Stein, who are just so productive and reinforcing and generative. And I want to put a plug in here for TLC, Jen. You know, TLC for me has been the glue that has kept us all together. And whether it's the scientific advisory board that brings, you know, all of us once or twice a year to get together to talk about what our latest endeavors are, whether it's the conferences that are put on, the hangouts you're talking about, whether it's the newsletter that, again, that just keeps all of us in it together. So thank you to TLC.
Thank you for that. We appreciate it very much. Hannah, what keeps you coming back every day?
These women have taken the words right out of my mouth, I think, but you know, it's the people, if I can just summarize it that way, not just professionally, but you know, the people who deal with this every day. And I think it's, you know, so rewarding to you know, help people feel understood. You know, I think unfortunately for many people, until they maybe start therapy or get connected with TLC, they feel so judged and misunderstood in so many places in their life. And so it doesn't have to be that way. And I think we're learning a lot about it, and it's really meaningful to sometimes be the very first person who's really ever stopped and listened to this person and treated them like a person, not someone with a problem. And just being a part of that journey is really rewarding.
It's so important. I continue to learn so much from each of you, and thank you for that. You know, I'm a sister of a person with trichotillomania, and growing up when I did in the 1980s, there was nothing for my sister. And I think back to this time, and then I look forward to where we're at now. And I'm just so appreciative for everything you and others have contributed to do exactly that, Hannah, to make sure that we're all treated with kindness and care. And that's a part of why we celebrate days like today, is to remind us of that and the work that we do. So another question has come in. What advice would you give to individuals interested in pursuing careers as BFRB researchers or therapeutic treatment providers? What advice would you give to others interested in this line of work?
So I can start with that one, maybe, since I'm the newest in that endeavor. But I think get involved in the community if you're not already. Go to an intensive training if you're interested in therapy. Go to a conference. Reach out to and connect with people that are on the board to learn about opportunities in whether that's in research or in clinical experiences or some combination. You know, just get connected, get more information and training, and get connected to people who can help steer you in the most effective ways to do that.
Some others?
I think Hannah nailed it. I think you really need to have people that you can share your cases with, people that you can discuss your research ideas with. I think research is a little bit harder. And what I would suggest is that you broaden your net to people that study OCD and other OCD spectrum disorders, It's the case that places like NIH, which is hard to get funding from, but they're now looking for more transdiagnostic research. So having that broader view, I think, would help you in terms of trying to get a research program going. And you start small, and hopefully along the way, you have the good fortune of having collaborators who you can share in their research, like the collaborative project, the BPMI that TLC sponsored. And hopefully you have the good fortune of getting some benefactors so that you can have a salary, which is always nice. But yes, that's what I would recommend.
Thanks, Nancy.
And I'd like to echo what Hannah and Nancy have both said. I think getting involved with TLC is really helpful and important. And having the training and then being able to get the word out that you have the training will allow you to build a practice. And I think that's important, because what used to be thought of as a very rare, a disorder is not that rare. And there's a great need for people who have experience or understanding in treating BFRBs, and people can build practices that are predominantly treating BFRBs. And I think it's that we need more people who really can and are interested in immersing themselves in that.
Go ahead, Sherrie.
Yeah. So, in addition to what other people have said, and I don't know who our audience is exactly, whether you're students or, already practitioners. But if you're a student, whether you're an undergraduate or a graduate student, I'd recommend, looking for ways to write papers on the topic. And that's a way to get educated yourself as in preparation. Then you start seeing who's writing those papers, and then, see if you can do an externship, with that group. But I think starting with just learning, and, there are a lot of papers in undergrad and graduate programs, a lot of papers written on OCD, not so many maybe with, BFRBs. And then that's a way to get your foot in the door by then joining this community and getting to know people, both people on the treatment side and people who are seeking help, who help teach the clinicians, what we know. So.
And I can add one more thing too. So, like Jen mentioned at the beginning with all of our bios. So I was a recipient of one of the TLC Early Career Awards. It was an opportunity to, interface with some of the more prominent people in the field, several of which are on this panel. But to have an established mentorship type program where you could, we were paired with or set up with one of the other treatment providers. In my case, I was in the clinical track. The researchers were paired with someone in the research track. And so that was a really nice opportunity to be built in and able to connect with that mentor just professionally, or to shoot around case conceptualization or treatment planning type ideas. So that could be something to look into as well in the future.
Great. What piece of advice would you give your younger self about this work? What piece of advice would you give yourself if you look back, what you know now, if you knew it then? What piece of advice would you give yourself about this work?
I'll start with that, I guess.
Okay, Sherrie.
I think the biggest piece of advice would be to build in to my sessions with clients on a very regular basis to use the assessment scales that Nancy and others developed, and to use them kind of religiously and not let them slip by. It's not like an extra thing, because that way you can, you think about clinically, you can track progress in a quantitative way with your clients, but also you're building up records that then at some point you could maybe use for presentations or, to say, help write, a proposal for something just based on the data.
Mhm.
So I didn't do it, and I still am trying to kind of do more of it. You don't do it every single session, although there are some things, some people who have certain, not specifically for BFRBs, but where they encourage feedback every session. But the instruments are really excellent and very, very valuable. So that's what I would tell myself.
I love how that all comes full circle. That's awesome. Others, a piece of advice you'd give yourself, your former self, your younger self?
Well, I think being humble, I keep going back to this, but being humble, being open to new ideas, not having preset notions. I think one of the things about our field is that very often we go into it with expectations and we try to squeeze things into these boxes when they're round. I think a lot of people started out thinking Trick was OCD, and it took a long time for people to be disabused of that notion. So to really, scratch all your preconceived notions, to be very inquisitive. I think for those that are in research, I'm such a believer in doing some clinical work on the side, that the clinical work informs your research and the research informs your clinical work. If you're lucky enough to be in a setting that supports both. But yeah, and just to stick with it and to draw your strength from other people, because as everybody on this panel has said, there's just so many people that are always there to help you, to be there for you, to reinforce you for the work that you do.
Thanks, Nancy. Ruth or Hannah?
Well, I would say, I'm not sure that I would have particular, I would just give myself maybe a tip of information, which is when I first started with this work and in this field, I loved it, and I found it so interesting, and the people were just awe-inspiring, and it was fabulous. And I would just say to myself, you're gonna love it still decades from now. Like it doesn't go away. And I think it's partly also what Nancy's saying as well, maintaining that open notion of being interested in continuing to learn and collaborate and learn from each other, and really, just loving the work, but also the people that are involved in the work.
So glad that this has been your passion, Ruth. And it's amazing when we find our passion, how everything else in the world just aligns, isn't it? It's pretty amazing. Hannah?
Well, I think I'm still learning a lot. And, being in it, really just for, now I guess almost 10 years. It's been about 8 years for me. So it does fly by. But I think when I was first starting out with clinical work, I think I was afraid of parents, sort of like I wanted to just talk to the teenager or the young kiddo, and I think would sort of shy away for whatever reason from including parents more in the session, as well as sometimes I think I used to want to just share all this knowledge I had about BFRBs of like, oh, you could try this strategy or this strategy. And I think the advice I would give to myself would be to listen to your patients more, give that, they know a lot. They know a lot more about their BFRB than you know about their BFRB. And so give them space to help collaborate with you about ideas of strategies versus you telling them a strategy. And then include parents and help educate parents and kind of destigmatize, demystify things. I think, you know, when I was very first starting out, it was a little different.
That's great. Thank you. So I'm going to turn now to some Q&A that's been coming in from our community members present today. And the first question is, I'm in graduate school for counseling. I'm sorry, for school counseling. I'm in graduate school for school counseling. How can I advocate for awareness of BFRBs as a future school counselor?
Well, I can, I think that's a great question, and it's a really important environment to get the word out. I have done talks for the county for school counselors and school psychologists, and I think that there are lots of trainings for school counselors and school personnel, and I think if you can either get yourself so that you feel like you could do a presentation yourself, that would be awesome. Or if not, there are presentations or people who could come out and do them, or do them via Zoom. But getting information out there, and good information into the schools, I think is really important and something to continue to advocate for.
Right, and TLC has such great pamphlets, you know, information that can be disseminated, that if there's ever any kind of like mental health presentation, just to bring the TLC literature out there, because, you know, we know the prevalence is, say, between 1% and 3%. So, you know, there are a number of students in that school that have, and that's just trip. And then there's excoriation disorder, which I don't mean to leave out of the equation. So there's a lot of students that haven't come forward yet with their needs.
Mm-hmm. Anyone else want to respond to that question at all? Okay, another question's come in. I have BFRB and I'm also a therapist. How can clinicians manage their job while also living as someone with a BFRB?
Well, okay, I'm going to jump in and start, because I think, first of all, everybody's got something. Like we all cope with our own things. So not to assume just because someone may not have a BFRB that they don't have anything to cope with. I think that's important to keep in mind. And then if you are a clinician with the BFRB, what you want to do is, I think, the same thing that we've all been talking about, which is be open to other people's experiences, so that you can best help that person. I mean, you know what's perhaps what has helped you, or perhaps what you struggle with, which may be helpful to your client, or that may not be helpful to your client. So be open to hearing your client's experience, and keeping in mind that when the client is in the room, that's the person you want to focus on, but that to also, you know, really live what you're preaching, so to speak, as well, so that you want to take care of yourself. When you're not in the room, you are the priority, and taking care of you, and making sure that you are doing what you need to do, whatever that may be, to help keep you as grounded and balanced as you possibly can.
Any other responses from the panel on that question?
Can't be perfection, I think. I think
I was just going to say that there's, you know, questions a lot of times what people should disclose. And early on at TLC, which started out mostly with retreats and that kind of thing, people, and some of them still are very openly say that they're recovering, or they have recovered, or however it is that they frame it, and that they actually use that experience to help their clients. But I would say, so I don't know where the field's at now in general, but if somebody's, you know, really struggling with their BFRB and they are a clinician, then I think it's they've got to be very careful about disclosing that personal information.
Mm-hmm. Mm-hmm.
I don't know what other people think about that, but you know, it's a tricky it's a tricky
Uh-huh.
situation.
I think it could depend. I think sometimes it could be really, powerful to, destigmatize it and be able to, and I think it depends so much on, the specific nature of what the client is there to work on, and, if they're asking, or, kind of how it gets brought up into the room in the first place. But I think it can potentially be very powerful to know, like, wow, here's this person who's seems to have their life together, and they also have a BFRB, and wow, maybe I can, live a happy, healthy life too. And it's not just about having a BFRB or not having a BFRB that dictates that. So I think it's a big, it depends kind of answer for me.
Mhm. The next question that's come in from the community is, what are the top 3 on your required reading list? And it says, I mean, reading broadly, any top media picks, experts, BFRB personalities that you'd recommend to someone who's just starting to learn more about this field?
Well, obviously, Charlie Mansueto and Ruth, and I don't know, Sherrie, if you were involved, but it was the last book, I think, that should be something that everybody should read as an introduction. Dr. Grant has written summary papers. I think anything from John Grant, I think you'll get a great overview. And then I think there's specific things written for children that Sherrie and Ruth have authored. So those would be things that I would recommend.
Others?
I second what Nancy said. Overall, I think good places to start, and that might, get you going down different rabbit holes of things that you might be more interested to learn more about. But I think those are good kind of broad overview places to start to learn more, and then to go from there.
It looks like that was the last question from community. I don't see anything else coming in. Hannah, did I miss anything? I'm just looking in my chat real quick. Okay. All right. Is there anything else, panelists, that you'd like to share as thoughts today as female leaders in this walk of BFRB research and clinical application before we wrap up today?
Thanks for putting it together and, getting this group together. I think we often sort of are in our own little areas and kind of tunnel vision focused on what we're doing. So it's nice to take the opportunity to, share some of these stories and, be able to have just the casual chat with everybody. So thanks for putting it together.
You're welcome. And we actually just had one more question come in that I think we have time for, and I would love to hear too, your answer to. Are there any female role models who have helped shape who you are today?
My grandmothers. Grandmothers are perfect.
Great. Others, female role models who have helped shape who you are today?
Well, I have to say, when I first joined the SAB, it was a daunting group of people who were extraordinary, including Nancy Keuthen from Mass General, which was pretty daunting. And one of the things that I found just tremendous was being able to speak with this group of people, Nancy in particular, who was always very warm and friendly and never made me feel, anxious or unworthy of, having these conversations. And we've gotten to be friends over the years, and it's been a wonderful, wonderful opportunity. So I think that, having lovely and important women, you know, in the field who are welcoming. And Nancy has done such a great job of welcoming others into the field as well. There have been like some really terrific women researchers that Nancy has really cultivated. And I think that's just very important.
And I feel the same way towards you, Ruth. Seriously.
Thank you.
I mean, this is what it's all about. I mean, this is what really keeps us all coming back.
Truly, truly. When we help each other rise, there's no place we cannot go, for sure. Hannah, what are you thinking?
Well, I'm thinking, you know, there are two standout women to me, and one is my mom, who is retired now, but was a judge, so had nothing to do with the field of psychology, but just always instilled in me, you know, work ethic and, you know, being passionate about what you do. So that has definitely influenced me. And then the other person is Suzanne Mouton Odom, who, you know, who I work with. I work in the same practice with her, and she, you know, has just gotten me interested in this field and hooked me in, and has just been a wonderful, you know, mentor all around, and just a great person to work with and look up to. And she wears lots of different hats, so she's very inspiring.
And we miss her here today. She would have been here, but she had a family celebration to attend today. So we give a shout out to Suzanne and for all of her achievements as well. And on that shout out note, we had a community member write, I just wanted to give a shout out to my OCD therapist who specializes in BFRBs. She is the woman who has literally saved my life. Honestly, the greatest, most inspiring woman I know.
Wonderful.
And on that note, I say thank you to each and every one of you on this panel for giving what you do to our community every day with your whole hearts. Thank you so very much. And it's already time for us to wrap up our conversation. So community members, if you have questions that we weren't able to answer today, please email them to info@bfrb.org. And on behalf of TLC, I would like to again thank all of our panelists for your time and dedication to our BFRB community. We are incredibly grateful for you. To the amazing TLC staff for pulling this event together today and translating it live in Spanish, thank you all. And for those of you joining us today, thank you for tuning in to this important community conversation. We sure hope to see you at our upcoming programs in March. The link is now in the chat to TLC's event page where you can learn more and get registered. And a reminder to please help us by completing the post-event survey, which is now linked in the chat and will also be in the post-attendee email that you receive. And if you appreciated the content of this conversation today, please consider making a donation to TLC to support our programming so we can continue to provide more community health education opportunities like this today. You can make a donation now at bfrb.org/donate. We look forward to seeing you all again soon. Thanks again for being here, and we wish you a very good evening. Thanks, everyone.